A lot of women, about 50% of women will actually experience this by the age of 50 or after. And we're talking about hair loss. It's pretty common in women who are going through menopause. We want to bring in Dr. Matthew Knight. He is the president of Knight Dermatology. He's also a member of the Florida Board of Medicine. Always great to have you, Doc, and happy Halloween.
Happy Halloween. I did not dress up today.
No, you look good. You look good. But it is appropriate that we're talking about this today because this is a really scary thing for women to experience.
It sure is.
Hair loss at any age is scary, but we're going through menopause. It's already a tough time, and then the hair starts falling out. It's a nightmare.
That's exactly right. And you know, for men, we kind of shrug it off. We're used to the typical male pattern of hair loss in the front and the back, and you know, your granddad had it, your dad had it, you have it, you just sort of say, oh well. But for women, it's a totally different story, as you've just said. You know, women can lose a lot of hair and not be noticeable. You can lose like 30 to 40% of your hair and it not be noticeable. But during menopause, with progesterone and estrogen dipping down, the hair becomes more brittle and the hair cycle changes. And so a lot of women notice a lot of hair falling in their shower. They come in with a bag of hair off their brush, and it's really, really heartrending for a lot of women in their 40s and 50s. Hair loss can be linked to anxiety, depression, and social isolation. People don't like to go out when they're losing their hair, and it's a big deal. You can ask any dermatologist. It is a gigantic deal.
Okay, so what is going on in our body that's making the hair fall out? Do we understand, like, sort of the ins and outs of it?
Sure. I mean, sometimes we can find reasons for hair loss, things like thyroid problems or anemia or other issues, autoimmune conditions like lupus. But most of the time we never find a reason. It's just menopausal changes. The hair follicle shrinks, the cycle changes because of the dip in hormones. It just changes the way the hair follicle works, and it falls out and becomes more brittle. And it become a major reason why people go to see the dermatologist. And it happens along with other changes that aren't wanted, like sleep problems and hot flashes and changes in body composition and mood changes in sleep and things that it's really upsetting for people, which is why the global economy around hair loss is like $1 billion market, and this stuff is everywhere. And that's good because our culture is kind of not taking this lying down anymore. We're saying, look, I know there's something we can do about this, so we're gonna try to make a change.
All right, let's talk about some of the options that are available.
Yes.
Where do you want to start?
Well, there's a lot, and I mean, we could be here all day running through all the options, and there's a lot over the counter. But the first big one is minoxidil. So this has been around for a long time. This is a blood pressure medication that we found out by accident grows hair. So the foam, which has been around forever, called Rogaine, is sort of the go-to. But there's an oral pill, minoxidil, that you can take. I'm actually on this medication to prevent male pattern hair loss.
You have great hair.
Well, it's because I've been on minoxidil for a long. No, it's but it helps. But there are some issues with this because it grows hair. It can grow hair in places you don't want it to be, like on the face, and it can cause lightheadedness and other problems. So you have to see a doctor for this one.
Okay.
There are also medications that are hormone blockers, like an old school diuretic called spironolactone, or something called finasteride, which is marketed as Propecia for men, but found out by accident. That drug is a prostate drug that we found out by accident causes hair growth or limits hair loss. And so, again, these are things that can be prescribed by a doctor that can help. The risk with those drugs is they can't be taken by anyone who's trying to get pregnant because they can cause birth defects. The big one I want to talk about is biotin. That's vitamin B7, and it's like in everything. And vitamin B7 or biotin was originally called vitamin H by the German researchers because it stands for hair. They thought it grew hair. We know now that unless you're deficient in biotin, it doesn't really do much of anything. But a lot of these supplements you're going to see over the counter for hair loss are going to be filled with biotin. The problem is biotin at a really high dose can interfere with labs like thyroid labs or cardiac enzymes, and it doesn't really do much. And so we're sort of moving away from that. The cool thing is on the horizon, we have all kinds of new things on the market coming for hair loss in women's 40s and 50s. Things like peptides, things like little signaling molecules or biologics or exosomes that can tell the hair follicle to turn itself back on. So we're not really stuck anymore with this hair loss that happens in almost everybody in 40s and 50s. There are things that we can turn to.
I love that. And if you have any questions, of course, go see your doctor or talk to your doctor about what's best for you. That's the best advice
For
always.
sure.
Yeah.
You know, and in this case, an endocrine specialist or a hormone specialist in tandem with a dermatologist may be the right way to go.
All right, you're the best, Dr. Knight. Thanks. Hope the boys have a great time trick-or-treating tonight.